Question 171. Which of the following nursing diagnoses is appropriate for a patient receiving famotidine, Pepcid? A. Increased risk for infection due to immunosuppression. B. Potential risk for bleeding related to thrombocytopenia. C. Alteration in urinary elimination related to retention. D. Alteration in tissue perfusion related to hypertension. Question 171. Answer: B. Potential risk for bleeding related to thrombocytopenia. Question 171. Explanation: a serious side effect of famotidine is thrombocytopenia, which is manifested by a decrease in platelet count and an increased risk of bleeding. Question 172. Histamine 2 receptor antagonists, A. compete with histamine for binding sites on the parietal cells. B. irreversibly bind to H+/K+, ATPase. C. cause a decrease in stomach pH. D. decrease signs and symptoms of allergies related to histamine release. Question 172. Answer: a compete with histamine for binding sites on the parietal cells. Question 172. Explanation: histamine receptor blocking agents decrease gastric acid by competing with histamine for binding sites on the parietal cells. Question 173. Proton pump inhibitors, A. gastric ulcer formation. B. GERD. C. achlorhydria. D. diverticulosis. Question 173. Answer: C. achlorhydria. Question 173. Explanation: because the proton pump inhibitors stop the final step of acid secretion, they can block up to 90% of acid secretion, leading to achlorhydria, without acid. Question 174. A patient unable to tolerate oral medications may be prescribed which of the following proton pump inhibitors to be administered intravenously? A. Lansoprazole, Prevacid. B. Omeprazole, Prilosec. C. Pantoprazole, Protonix. D. Esomeprazole, Nexium. Question 174. Answer: C. Pantoprazole, Protonix. Question 174. Explanation: pantoprazole is the only proton pump inhibitor that is available for intravenous administration. The other medications in this category may only be administered orally. Question 175. When administering sucralfate, carafate, to a patient with an esogastric tube, it is important to A. crush the tablet into a fine powder before mixing with water. B. administer with a bolus tube feeding. C. allow the tablet to dissolve in water before administering. D. administer with an antacid for maximum benefit. Question 175. Answer: C. allow the tablet to dissolve in water before administering. Question 175. Explanation: it is important to give sucralfate on an empty stomach so that it may dissolve and form a protective barrier over the gastric mucosa. The tablet form will not dissolve in water when crushed, it must be left whole and allowed to dissolve. Crushing the medication so that it will not dissolve could lead to clogging of the nasogastric tube and decreased effectiveness of the drug. Question 176. Sucralfate, carafate, achieves a therapeutic effect by A. neutralizing gastric acid. B. enhancing gastric absorption. C. forming a protective barrier around gastric mucosa. D. inhibiting gastric acid secretion. Question 176. Answer: C. forming a protective barrier around gastric mucosa. Question 176. Explanation: sucralfate has a local effect only on the gastric mucosa. It forms a paste-like substance in the stomach, which adheres to the gastric lining, protecting against adverse effects related to gastric acid. It also stimulates healing of any ulcerated areas of the gastric mucosa. Question 177. To avoid fecal impaction, psyllium, Metamucil, should be administered with at least how many ounces of fluid? A. 4. B. 6. C. 8. D. 10. Question 177. Answer: C. 8. Question 177. Explanation: Bulk-forming laxatives must be given with at least 8 ounces of liquid plus additional liquid each day to prevent intestinal obstruction. Question 178, bismuth subsalicylate, Pepto-Bismol, as an absorbent, has which of the following mechanisms of action? A. Decreased GI motility. B. Decreased gastric secretions. C. Increased fluid absorption. D. Binding to diarrhea-causing bacteria for excretion. Question 178. Answer: D. Binding to diarrhea-causing bacteria for excretion. Question 178. Explanation: absorbent antidiarrheal medications bind to diarrhea-causing bacteria to form a non-absorbable complex, which is then excreted in the stool. Question 179. Side effects of loperamide, Imodium, include all of the following except A. Diarrhea. B. Epigastric pain. C. Dry mouth. D. Anorexia. Question 179. Answer: a diarrhea. Question 179. Explanation: side effects associated with loperamide include CNS fatigue and dizziness, epigastric pain, abdominal cramps, nausea, dry mouth, vomiting, and anorexia. Diarrhea is an indication, not a side effect. Question 180. The mechanism of action of diphenoxylate, Lotamil, is A. an increase in intestinal excretion of water. B. an increase in intestinal motility. C. a decrease in peristalsis in the intestinal wall. D. a decrease in the reabsorption of water in the bowel. Question 180. Answer: C. a decrease in peristalsis in the intestinal wall. Question 180. Explanation: diphenoxylate acts on the smooth muscle of the intestinal tract to inhibit GI motility and excessive propulsion of the GI tract, peristalsis.